yet again, it is the front row seat to the voices, front row to the voices. Another edition, again with another great and awesome person. My name is Faith, your one and only beautiful princess with this particular interview. Good afternoon, ma'am.
Good afternoon.
How you doing today?
I'm good. I feel youthful. I feel young.
Of course you should. I was even about to say, you know what, madam, at this point, please don't be the manager. Be me, you know.
By the way, I'd rather, identify myself as the young person than the manager.
Yes, please. That is the spirit that I want. But I'm pleased to have you.
Thank you for having me.
Alrighty. So starting with, I just want you, of course, I've had the manager and, Amref, but then they don't know the manager and the Amref. We just want to know who Vivian is. So just a short introduction to our teenagers there and those that are watching you today.
Okay, so you've introduced me. I'm Vivian Sakanga, working for Amref Health Africa in Zambia. I've been with Amref for the past 7 years. And with Amref, we're passionate about building or creating lasting health change in Africa. Lasting health change means really building sustainable, resilient health systems, especially at the community level. So working with the different stakeholders, but our focus is mainly around women and young people. So we are here within our stakeholders, within our constituency, to ensure that we continue supporting and building lasting health change, not just for Zambia, but across the region. So that's who I am, and the mother of 3. And
I'm the first one, by the way. That's a lie.
Raising also teenagers, young people, gives me an opportunity to also find this endeavor very timely and relevant, because I get to understand the needs from the other side and have an introspection on how I'm dealing with my own young people in my home.
I love the fact that you mentioned the Amref is not just about Zambia, but you are around other countries.
Yes.
And now this is the regional adolescent health endeavor. As Amref, what has been your experience so far as the manager representative at this year's RAHi? It's only been about a few hours. How's been your experience so far?
I think the endeavor is starting at the right tone. I am finding the energy in the room. I'm hearing young people saying they are not just beneficiaries, but they're the owners of the interventions. They should come up with, resolutions that should be able to drive the agenda or drive the interventions that concern themselves, which to me gives me hope for the endeavor. It's just starting, but it seems like people have come with the right mind. Even the policymakers we had in the room, they've been supportive. They've been saying, we are bringing you on the table. They're respecting the young people to be on the table, to bring out the issues, but also be able to bring out the recommendations on what those issues are. How should we address the issues of teenage pregnancy? In Zambia, we know that the teenage pregnancy rate is not going down. So we need to hear from the young people themselves. Why isn't it going down? What can we do to ensure that we curb the teenage pregnancy? We are hearing that HIV prevalence amongst adolescents is going high. Who else but the young people to start thinking of the interventions that could bring that sustainable or lasting change within the communities? I feel we are here at the right time. And the fact that we're not just talking about Zambia, we're talking about the region. Like you've said, we work in the region, and so having regional conversations for us is always something of great interest, because we want, like I said, we talk about Africa, not about the country, and we know that experiences from one country can be applicable. Our cultures are similar, even the way of life is similar. So whatever we bring out from this regional endeavor, it's really something that can be applicable to Africa as a whole. So it's exciting to see the young people coming from all sorts. Actually, that shows actually how they really value their lives. The lives of their own lives, but also the lives of the people that they are representing. I heard one young lady saying, we are representatives. Let's not let our people down. So it's interesting. I always also again ask myself, what was I doing when I was 19 or 24 years? I wasn't much of an advocate. So I'm always challenged. It's always good to see how young people nowadays really have the zeal and determination to address the issues that affect them.
You did mention about how passionate you are as Amref about the health of the young people and adolescents. This is at a regional level.
Yes.
I just want to know, how has been the feedback with the young people in terms of your core value as Amref? Has the response been positive? Has it been worth continuing as Amref?
I think the response has been great and has been in a way inspiring, because we bring the young people to the table. Amref actually has got a directorate for young people. We then have an initiative called Youth in Action, because we believe that the solutions need to come from the young people themselves. So we've given that platform where they come and discuss issues, and of course as Amref we build their capacity to ensure that they are able to have these meaningful conversations which are evidence-based. They're able to stand on bigger platforms for them to defend or discuss the issues that they are bringing to the fore. So I feel it's been very, they've been forthcoming. We've opened the door for them, and yeah, we are seeing good values coming out of the engagement. Even on our boards, we do include young people to sit on the board, because we value their inputs, we value their strategic thinking. We are now, when we want to come up with interventions, we believe that we need to be at their level. Sometimes we can as older people, but the young people themselves need to come and represent themselves. So we really value their input into the works and mission of Amref.
Great. So don't say youths are not involved. Number of our Amref folk. So aside from that, leading me to my last question, of course, last but not the least. The adolescent health endeavor has been happening. This is now the 5th year. And in these 5 years, in one way or the other, if not 100%, at least 75.2, there should have been a change or something to show that the RAHi happened, things were taught, and the change has been seen. So from you, what has been the impact of the RAHi now? So when we say now, we're probably even looking at the projection of the past RAHis, the adolescents that have been attending. What has been the feedback from Amref, as in what the young people are doing? Is it something that is worth riding on?
I think I may not have closely followed all the 5 RAHi, but I believe that RAHi has been a great platform bringing young people together and building their capacity around issues that concern them, especially around sexual reproductive health and HIV and AIDS. And I always tell myself that 2 are better than 1. So within these conversations, a number of resolutions have been made, which I believe have been targeted to our policymakers. I like that these conversations start from the provinces. They mentioned that they have provincial endeavors.
The RAHi,
yes,
the districts, and the province, and the regional.
So it's really going up to the grassroots to understand the issues at the grassroots level. And that's the role of a platform. We may not have everyone in the room, but I believe the issues coming from the grassroots have been represented. 2, I think the themes are always relevant and timely. This year's theme is something that we are all not used to, but I believe it's a very timely theme. Looking at issues of entrepreneurship, issues of youth creation. Young people are at a stage where they're either in schools, gaining skills, and after school, what is expected? It's employment. Sometimes employment is not forthcoming. So how do we start positioning ourselves as young people in the space of, then become employers ourselves? The young people are very innovative. They're very smart, they're very sharp. So how do we start supporting them within this process that they're still undergoing to build their skills around becoming self-reliant, living dignified and meaningful lives? And again, when we're talking about that, we tie it to the well-being. That's why health comes in, primary health care, because we cannot separate health from the ecosystem, right? So starting this conversation is very timely. Starting this conversation is relevant. And so within the platform, I like the fact that we are looking at this RAHi at having different, it's not business as usual every year. They try to make it interesting, they try to make it innovative. And I'm really looking forward to seeing what comes out with this theme around youth entrepreneurship and youth creation in the primary healthcare sector. I've met quite a number of young people who've trained within the healthcare space as nurses, as biomedics, as physiotherapists, and they don't have jobs.
That's true.
They're still yet struggling with these health issues, but sometimes the well-being also is associated on how you're able to look after yourself.
That's very
And when you have a job or you have a way of sustaining yourself, economically, your well-being is also improved. Amref, we look at health as an investment rather than a cost. And so that's how we start. We are looking at health within the ecosystem and really want to ensure that these are conversations that start now, so that even as our young people, the majority, actually a third of the population in Zambia is young people. So we need to start preparing them for the future. Yeah, so the platform really is about bringing timely conversations and bringing our resolutions. I'm looking forward to seeing the resolutions coming out and the intended stakeholders and how those resolutions will be addressed. The fact that we have, the Minister of Health also shows that the policymakers value the young people and value this platform. So they've set a legacy which has now become regional, and who knows, we might find ourselves going global, and that's something to look forward to.
Is there anything that the young people should be looking forward to from Amref?
Yeah, I mean, we are here to help them. Well, they are our partners.
Yeah.
So we're here to work together to see how we can improve the well-being of the young people. So within our programming, we're looking at issues, for example, what I mentioned, them help building meaningful and dignified work, finding meaningful and dignified work. We're looking at helping them gain skills. So we work quite a lot with training schools within the health sector. We're looking at issues of advocacy. So they are welcome to come to us and see how we can support them in addressing issues that really are affecting them.
So you're open and willing to accommodate us as long as they are alive?
If I had one wish, I would want to become a young person again.
So that's
the energy. So please, our doors are wide open. We are found along Los Angeles Road, and we're happy to have conversations.
Okay, great. Well, that could have been like one of the longest. But before I go, you know what I do? Before I let you go, as a mother, as a wife, a manager, at this point, I just want you to be a mother and Vivian as a person. Detach manager, just be Vivian as a person and as a parent. What is your message to the young people? This could be about the RAHi and also any other message that you have for them.
Yeah. So I think I would start from never giving up. So much is happening in the world, and you have the right, you are the right pace, your determination is seen, and you have the capacity to achieve your dreams. As your mother or as your elder, I'm here to hold your hand, but I believe in your dreams. I believe in your capabilities, and if you're able to achieve it, don't set limits for yourself.
Hi. That one hit bad though. I feel them. Well, guys, thank you so much for joining us for yet this beautiful episode. We still have more coming your way. Just stay glued, and thank you so much for being part and parcel of this. You've heard from her. Their doors are always open. And if you have a problem, this is a message to you. If you have an issue, please find somebody to talk to. Is it because you were defiled? Could it be abuse, early pregnancy? Whatever it is that you're facing, there's always a solution to it. Stay tuned.